My name is Munene. I'm the health program manager, Give Us Wings, Uganda. I'm stationed at St. John's Kayoro Health Center 2. St. John's Kayoro Health Center 2 has been in existence for the past 4 years. We have grown into a robust and active healthcare provider in Kayoro district. We are mandated by the government of Uganda to provide outreach care, preventative, promotive, curative services, emergency deliveries, and laboratory services. Our main focus, or our goal rather, is to equitably improve the lives of people in the communities that we serve in light with health. We have...
Go.
So St. John's is a healthcare provider that is placed in an environment with a lot of dynamic health-related issues, or challenges rather. One of them being malaria, which is the #1 killer disease for children under the age of under the age of 5. We have cervical cancer, which accounts for 80% of all cancer cases in Uganda, and these are statistics provided for by Uganda Cancer Institute and Mulago National Referral. We also have about 48% of women attending only 4 visits, which is really recommended for antenatal services, as opposed to the 95% women who attend only 1 antenatal care visit in a healthcare provider throughout their pregnancy, which is really a big gap in the community. We have about 60% of women, married women actually, or women who have been in marriages, having problems or experiencing gender-based violence, and thereby being inflicted with a lot of injuries, and psychologically and physically. So we also have the poor health-seeking behaviors of the communities, the people in the communities, where people tend to put more focus on traditional ways of herbal medicine, witchcraft and sorcery as the first-line treatment, as opposed to the conventional medicine, which really is ideal for any person, really. So we are placed in a community that has these dynamic issues. And as a health program, we are learning to develop. We are learning to adjust and to try and help the community overcome these particular issues, because at the end of the day, we realize that they are the ones who are losing out. So as St. John's Kayoro Health Center 2, our main focus is to equitably improve the health standards of the communities that we work with. And that's why Give Us Wings and St. John's Episcopal Church established St. John's Kayoro Health Center 2. One of the key milestones for the year for St. John's Kayoro Health Center 2, or the health program rather, is to institute a community health insurance scheme. We intend to institute a community health insurance scheme that will be based on the principles of solidarity and cost sharing, rather, yes. We seek to increase on the numbers of people that are going to receive healthcare, and that's really one of the major areas that we want to focus on, because we believe out there people are willing to cost share for their medication, and St. John's Kayoro Health Center 2 wants to work with the community. Thereby we shall have an increase in the community, the patients and the clients, ultimately providing the best possible treatment to them. One other key milestone for the year for St. John's Kayoro Health Center 2 is we would like to construct a maternity ward. This in light with maternal child health care, which touches the biggest percentage of the Uganda population, which consists of women, the youth, both male and female, then children also. So we would like to have a construction of that ward, which ultimately we shall have attendances of children, women of childbearing ages, children under 1, children under 5, pregnant mothers, husbands, and or partners of the pregnant women, and also sexually active male and female youth. Those challenges are going to be addressed by the construction of this maternity ward. We are working around the clock to ensure that we look for resources here and there. I would like to report that in January we wrote a proposal to the Japanese embassy for the construction of the maternity ward, and we are in the 3rd month waiting to get a feedback from the Japanese embassy whether the construction can be done. Otherwise, we are not sleeping. We are doing everything that we can as the health program to ensure that we receive technical, material, financial, and human power support from whichever partners that we work with, or let me add, strategically work with, because we have partners that really serve in various capacities, and really in light of our strategic objectives, which are to promote maternal and child health care. We have also another strategic objective being promoting health-seeking behaviors, positive health-seeking behaviors for people who have chronic diseases, thereby mitigating the negative effects of these illnesses. We also have promotion of nutrition, sanitation, and hygiene. We work with schools, the community, the youth, with respect to adolescent sexual reproductive health care. Also, one of our strategic objectives for the year, actually it's a 5-year objective plan, is that we want to provide quality and improved services timely to the community that we work with, and to the community that really deserve. We do not segregate. We work with with people of all areas that we work with. We work under, we work with 3 sub-counties, that is Rubonge, Osukuru, and Magola sub-counties. Recently, we had a meeting with the health assistants, and we were reliably informed that there were specific areas in the community that were medically underserved. And it is through that we open new outreach sites in places that are underserved, and that caught the attention of the government, thereby giving the health center grants. These are known as Global Alliance for Vaccine and Immunization. This is to support the extended outreaches. So that's one of our key improvements, or really, I would rather say, milestones, which really we have had over the years because of constantly trying to learn and adapt to the community, providing whatever positive and quality medical health care that we can as the health center. I would like to appreciate the support given to us by Givers Wings and the St. John's Episcopal Church. It hasn't been easy starting up a health center, but we share in your dreams, your hopes that the community will receive the best quality healthcare services, regardless of having limited, sometimes limited, or whatever resources that we have. 90%, I would really like to say, we are going to focus that resource, whether it is material, whether it is financial, whether it is human power, whether it is technical. That percentage has to go, or has to trickle down to the community. The community has to go first. It has to enjoy these services, and that's what the health program stands for, thereby equitably improving the standards of the community that St. John's works in. Thank you so much. I would really like to ask that you keep on praying with us. I'm actually very happy that the Givers Wings volunteers came to Uganda. It has been a very good working experience. We have learned from them. They have also learned from us. They have learned from the community. I know there is a lot that they're going to take back to the USA. And really, learning never stops. We really like to encourage them to keep on coming. And we shall always provide the necessary support that they need, that the community needs, as as St. John's can reliably, can be able to provide. Thank you so much.
Thank you.
So we did 6 interviews of the kids, and I wrote down their names and who they were, the daughter or the granddaughter, a very shy